Good morning, everyone. In this lecture, we are going to discuss, like in the previous lecture, we had discussed about the X rays in imaging, and in this one, we are going to talk about not in detail, but like just as you can see, introduction about other imaging modalities which are in regular use or which are used nowadays for different diagnostic purposes. So now, uh, the good thing, like in undergraduate exams, they don't show you these things. We have different OSCE exams, like Vivas and stuff like this. So even in the Vivas, they show always a X-ray or maximum a CT scan, but never you can say a SPECT scanning or PET scan or things like this. So, but of course, like there should be knowledge about how what are the things which are available and what's going on, right? So that's why I'm going to discuss them. So basically, what we call them as, uh, for example, one of the thing is ultra, or you can say like other modalities. Okay. Now, one thing which I think like all of you are familiar with is called as ultrasonography, right? Now, ultrasonography is simply uh, this is very commonly available in almost every setup nowadays, and what it uses is basically it works on the sound waves, and that's the reason um, we can just do ultrasonography. Um, you can say in the areas where there is no bony structure, because the sound waves cannot be transmitted across the bone. So I want to show you the ultrasound machine. And nowadays, there are many small machines are also there, portable machines, and what is there? Like there's a probe. Okay, you can see like everyone is fitted with probe. So what they do, like they put this probe mostly on abdomen, and the sound waves goes, and they make images. So that is like ultrasonography, and then there are other techniques which we call as um, ionizing radiation techniques. Ionizing radiation techniques. So now they are many, by the way. Like many of them, maybe I don't know because like they are too many. So, for example, one thing is called as CT scan. Okay, which is computed tomography scan. You can say like which is quite available these days, right? So this one is called as this one based on ionizing radiation techniques. And if I want to classify ultrasonography, for example, so how we can classify it is called as non-ionizing radiation techniques. Radiation techniques. Okay. So now, for example, in this one works on the sound waves, or MRI or magnetic resonance imaging. That is also a non-ionizing techniques. Whereas the ionizing techniques, one is CT scan, then there is PET scanning or positron emission tomography. Then there is SPECT scanning. Well, they are like both almost more or less the same things. Then there is fluoroscopic studies. Then there is, you can say, nuclear imaging, or radionucleotide imagings, which are available nowadays. So simply, like these are, you can say, two modalities other than X-rays, of course, like which are quite available nowadays. Okay, I will discuss CT scans in details, like, but before going to CT scans, what I want to show you, One thing which I wrote right over here is called as fluoroscopic studies. Now, what is fluoroscopic studies is basically um, like X-rays, for example, um, uh, or CT scan, for example. They don't show you the moving things, okay? But fluoroscopy, I will show you a fluoroscopy machine. See, like this is called as a C arm because like the arm is like C. Fluoroscopic machine, you can say. Okay, this is this one. Okay, so what is the thing? This thing is basically this one uses X-rays, number one. Okay, but this one can give the moving images. So what it means, like the X-rays will keep on falling and we can see the thing inside. So you can say like it gives moving type of images. Like GIF, I was searching for any GIF image like which basically is moving as well, but I couldn't found it. So this one is like one of the fluoroscopic studies, but this one is still. So this is like what they give the patient is barium. Okay, so barium, uh, uh, when the patient they eat barium and we take this image, so see it appears very clearly. So now when the patient is swallowing that, we can take the image and we can see this moving image. So to catch, for example, dysphagia and stuff like this, right? So it uses X-rays. The only difference is it can give moving images, right? And why it is called as fluoroscopic studies? Simply like um, we are using barium, okay, which is uh, catch by this fluoroscope. So you can say like that's why we call it as this thing. So it is a form of ionizing radiation, right? So the thing is, for example, um, this fluoroscope, okay, which is fitted over here, we can see the internal structures which are continuously moving. Like this one is about swallowing. A patient who will have dysphagia, we can check them through this, right? So nowadays, they are using a lot fluoroscopic studies in interventional neurology or interventional radiology. Okay, so this is fluoroscopic studies, and then there is uh, you can say the nuclear studies, nuclear medicine. In nuclear medicine, why we call it as nuclear medicine? Nuclear medicine or nuclear imaging simply. Uh, these are those which you can say which involve some uh, radioactive substances simply. Okay, so now there are two main things, uh, what you can say, which we have to cover in this one, or which we can see in this one. One, I told you, it is SPECT. What is SPECT? It is single photon emission computed tomography, right? So this is called as SPECT, SPECT, and the other one is positron emission tomography. So it is called as PET. Okay, so SPECT and PET. Okay, uh, now the thing is, uh, I can show you the images. For example, this one is a PET scan. This one is a PET scan. Okay, and for example, I will show you other photographs of some radiology medicine. For example, this one. Now, this one is 3D cortical perfusion display. Okay, see, so it's a type of a nuclear medicine, or same photograph like you can see like this one. Okay, so now the point is like this nuclear spect or PET, this is a type of nuclear medicine, okay, or it's a part of nuclear medicine. So what happens is nowadays they use these modalities a lot in diagnostics, okay. For example, this one, whenever someone have cancers and if you want to see like metastasis, they always ask the patient to go for PET scanning, okay, to see like the secondaries, either they are present in the bones or not, okay. And this one, of course, they both are related with the brain. But for example, we can check the myocardial perfusion by using some thallium, okay. So simply like depending on the structure, we can check the liver or hepatobiliary system, we can check the lungs, and nowadays, by the way, they can make a 3D image. They can even create a 3D image out of these. So these things are used for that thing, for these purposes. So there are different type of examples, in nuclear medicine. So what we do, we are using basically radionuclides, radioactive substances, you can say. So if you remember, there is radioactive iodine uptake, in which I teach you in thyroid disorders. So sorry, to your seniors, by the way. So that one uses iodine 131. Okay, so same thing like this. So we are using some radionucleotide. So that's why these kind of things are there. So okay, now for example, I will show you some more images about ultrasonography. I show you SPECT and fluoroscopic nuclear. Okay, so MRIs, they like the machine looks more or same like CT scan machine, and the only difference is uh, MRIs. Okay, MRI. Oh, okay. What is MRI? It is basically magnetic resonance. Basically, this is a topic of radiology, which I'm just giving you introduction. Okay, it is called as a MRI. So now, as the name shows, magnetic resonance imaging. So, okay, so now simply MRI machines uses magnetic fields, okay, and radio waves to create or to generate the images. For example, I will show you a MRI machine. Okay, like the see, that's why I told you this one looks more or same like a CT scan machine. Okay, so now this one is basically using magnetic field with radio waves. Okay, and how the scan appears like is same like um, okay, it's same like you can say a CT scan like this one. Okay, so in this one, like they are showing you a parasagittal MRI of the head. Okay, parasagittal means like what? They take it in the halfway parasagittal, right? So this is like MRI. Like rest, when you will study radiology, you would know like what is T1 weighted images, what are T2 weighted images, and contrast and non-contrast, and things like this. Okay. So anyhow, like this is how MRI looks like, right? Um, Other than MRI, now we are going to talk about CT scans. Okay. So now CT scans or computed tomography. Now this one is very commonly computed used type of scans in medicine. Okay, can done in emergencies as well nowadays. So what is the good thing about CT scans and MRIs? Basically, we can create a cross sectional image. See, it's a cross section. See, it's a cross section, right? So what we can see or what you can create by MRI or by CT scan is basically you can create a cross section image. So that's an important thing to remember in this one. Now, CT scan, remember, it uses the same ionizing or X-rays simply, right? Uh, and nowadays, again, even CT scans can produce 3D type of images. But in most of the hospital, what you will see like is the normal type of CT scan. Okay, so this thing. Uh, so now you can see like this is the thorax and this is also the thorax, right? But the sections are different. Okay, simply. Um, okay, and now see you can see over here. Basically, there is abnormality in CT scan, but of course, like you are not able to catch at this stage. But there is abnormality in this one, right? So for example, like the abnormalities over here, there is like it's a CT scan of a pulmonary embolism. But why I wanted to why I placed it here simply to show you how CT scan works. Okay, for example, I will show you one more uh, type of scan. Okay, now this one is a scan which is done, and see the patient ID, date of birth, and everything is written over here, right? And see, we can clearly see the stones. So this one is basically called as MRCP, magnetic resonance cholangiopancreatography. So this is not a CT scan. This is MRI or basically MRCP. Okay, so you can see like this is basically MRCP. Okay, uh, magnetic resonance cholangiopancreatography, and you can see like we can see the stones, gallstones in this one, right? So very commonly done in the hospitals nowadays. And again, one more. Okay, this one is so small. Sorry, we can let it go. Okay, now the most important thing I think to talk about in this section is CT scan of the head. CT of head. Okay, now CT of the head is a very common type of test or imaging ordered in the daily practice. Why? Because many people they have had trauma. Many people they present with some headaches, or you can say different type of headaches, things like this. So the most common type of CT which is ordered nowadays in daily practice, I'm saying, or in emergencies, is basically CT scan of the head. Why? Because uh, it is quick, it is inexpensive, the report comes back as fast, and uh, on that, we can simply see like what's going on inside. For example, whenever the patients they come with stroke, stroke, uh, or you can say brain infarction or brain hemorrhage. So a CT scan is the best modality to do it quickly and to find out either it's an infarct or it's a infarction or it's a hemorrhage. Okay, so now, for example, like nice guidelines they come from UK. So not the nice guidelines, not just nice guidelines, Americans, they have given indications when to go for a CT scan after trauma. For example, any patient who you can say whose GCS, Glasgow Coma Scale, is less than 13. Okay, anyone who have a fracture of the skull. Okay, a fracture of the skull can open or depressed one. Okay, especially um, anyone who have signs of fracture base of skull, like it could be CSF rhinoria, it could be otoria, anything like this, right? Or it could be raccoon eyes. Okay, or like battle sign, so things like this. Okay, yeah, anyone who have seizure after trauma. Okay, anyone who have any focal neurological deficit. So these things, and anyone who have more than one episode of vomiting. Okay, okay, the whatever I'm talking about is like after trauma. Okay, anyone who have amnesia, when the people have trauma, they can go, they have amnesia. So amnesia more than 30 minutes. Okay, so this is important. Less than 30 minutes, we don't go for minutes. All these, if present after trauma, to head warrants or CT scan of head. Okay, so see, whenever the people they come after trauma, and we found any one of these things, we directly go for the CT scan of the head. Okay, so remember, like this one CT scan of the head can be done in trauma, can be done in stroke patients. Okay, to rule out either it's a hemorrhagic stroke or either it's ischemic stroke. So okay, of course, like we will not go in too much detail, but how to approach or how to see the CT scan of the head, I will show you. For example, I will open here CT scan or normal CT scan of head, normal CT head. So you can see over here. Okay, wait, just give me 1 second. I don't know what's wrong. Okay, so this one is like the normal CT scan of the head, right? You can see. So see, first of all, you must know what are the anatomical structures in the brain. Okay, these are the ventricles, and a very easy way is um, to see either is supratentorial structures or either is infratentorial structures. Now, like if you know what is tentorium, then I think the things will be easy for you. Okay, so of course, like this one is a supratentorial structure, not the infratentorial one. And what we can see is we can appreciate lateral ventricles in this one. Okay, we can see like a chorioid plexus, not so much good visible in this one, but see. So basically, uh, how we see the CT scan is simply uh, depends on in the brain there is what you can say. See, there are different shades here as well. See, these are like the bone is too much whitish, right? And now make the concept. What's here? The CSF. So CSF appears black. What is this? This is bone. So the bone appears white. Okay. So now one thing is clear. This is fluid, it is black. This is bone, it is white, right? Now, any color which is in between, of course, it's the soft tissue. Okay. And now you can see like the gray and white matter within the brain have different colors. Okay. So the densely packed nerve cell bodies of the gray matters. See this one, gray matters, right? So that's why if you can see like they are more whitish. Okay, and sorry. So because in the gray matter the cell bodies they are densely packed. Okay, then the white matter in which there is like the axons. So now white matter basically it appeared darker than gray matter on CT scan, right? Just like remember the thing. So now whenever there is any hemorrhage, for example, I will show you. Okay, I included like many of the. Okay, now see, this is the infarct. This one is a CT scan of an infarct. Okay, this is infarcted area. See, it is appearing more blackish. Or for example, you can see this one. This is a CT scan of the hemorrhage. Sorry. Okay, this one is a CT scan of a hemorrhage, right? Subdural hemorrhage. Okay. So now, of course, whenever there is hemorrhage, so it means like there is blood. So the blood contains proteins. So that's why it make it more dense. Okay. So basically, when there is acute hemorrhage, the area becomes like appear more whitish on the CT scan, and the area of the dead or damaged brain, okay, they appear less dense. Okay, so less dense means like, of course, it will appear darker. So remember, like, whenever it is less dense things like water, so it will be darker. Whenever it is more dense things like bone, it will be whiter. Okay, like, so this is how we see. Now sometimes, we also give intravenous contrast, and then we can take the CT scans just to see the vessels of the brain. Okay, things like this. So that is, of course, to diagnose, like, whenever there is any cancers, whenever there is any tumors, things like this. Okay, in that case, it is called as a contrast CT scan. So now see, very easy way to check. By the way, just give me 1 minute. I will put all the photographs I have. Then I will tell you like why I choose these one to show you. Okay. Uh, okay. Now see how we can assess or we can evaluate this one. You can see in the normal CT scan, you can divide it in half, and both structures, they look same. Okay, there is no midline shift. But if you will see, in case of this hemorrhage, the blood is causing pressure on the brain, and see, the blood is pushing the brain on one side. So see, this one, which should be like this in the midline, so this one is moved over here. The ventricle, which should be over here, it is pressed over here. So there is a midline shift of the structures, right? So that's why whenever we see a CT scan, number one, we see either the ventricles are of appropriate size. In this one, they are not. We see either there's any acute blood which is present. We see like all the areas, like here we can catch easily. We see like either there's any evidence of ischemia. Okay. We see like either we can easily differentiate between the white matter and the gray matter. Okay. We always see, for example, if there is any mass, we can see like this one. Okay. Now see, and then we also check the skull bone. Okay, like if it is fractured or broken from anywhere. Plus, then the review areas in this one is like the ventricles. Okay, so you must see like either there is any blood in this horn, occipital horn, okay, of the ventricles. We can see the orbits as well. We like, okay, I will show you how they look like. So the orbits, see, this is of course a CT scan taken at lower level, in which the orbits are also visualized. Wait, I think some problem with the internet, because Bing always work fast, but now it's not working fast. So anyhow, I can show you over here. Now see, you can see the CT scan over here or here, in which like we can see the orbits. Okay, orbits. So of course, like this one will give us the more insight. Okay, see the orbits, right? So this is like you can see like this is how we check. Okay, so see the orbits, and also we can see the mastoid cells. See mastoid cells. Okay, they are behind the ear. Okay, so simply like all these things are the review areas. So check the orbits, check the mastoid cells. So by the way, like of course I'm showing you the CT scan which are taken on one level, but like when we get the complete CT scan report, so in one report they have multiple images, right? So they have taken them at multiple levels. Okay, so this is all about the other modalities of imaging. I hope you understand. Thank you so much, guys, for listening.